Welcome back to AMC Decoded. Today, we are decoding MCQ number 6 of our High Yield MCQ series for AMC, USMLE, PLAB, MRCP, and NEET medical examination. And this is a topic that appears in every major medical board exam. Why? Because it kills quickly, and the examiners want to know if you can spot the killer. You need to recognize the classic signs: headache, fever, neck stiffness, and the dreaded rash. Let's master the safety rules. Here is the question. A 19-year-old male university student is brought in by his roommates due to confusion and severe headache starting 6 hours ago. He lives in a crowded dormitory. No significant past medical and surgical history. Temperature is 39.8. Heart rate is 125. BP is 90/50. Respiratory rate is 28. Oxygen sat is 94% on room air. On examination, he appears drowsy and confused. Mark nuchal rigidity. Clinic sign is positive. A rapidly spreading, non-blanching purpuric rash is noted on the trunk and lower limbs. You suspect meningococcal septicaemia. You attempt to insert a peripheral IV cannula, but it fails twice due to collapsed veins and poor perfusion. What is the most appropriate immediate next step? A. Request an urgent CT brain to rule out a raised ICP. B. Administer intramuscular ceftriaxone or benzylpenicillin. C. Attempt a third peripheral IV line with ultrasound guidance. D. Perform a lumbar puncture immediately to isolate the organism. E. Intubate and ventilate the patient for airway protection. Now, I want you to pause the video right now and lock in your answers. Ready? The answer is B. Administer intramuscular ceftriaxone or benzylpenicillin. Let's try to decode this. First of all, our diagnosis: meningitis. What is meningitis? Inflammation of leptomeninges and the subarachnoid space surrounding the brain and the spinal cord. This inflammation will trigger the triad of headache, fever, and neck stiffness. For neonates, less than 3 months, the most common organisms are groupie strep, E. coli, Listeria. For adults, it's strep pneumonia or Neisseria. And for elderly or immunocompromised patients, it's strep pneumonia and Listeria. Now, if the exam mentions gram-positive bacilli, that is Listeria. If they say gram-negative diplococci, that is Neisseria, the one likely causing the rash in our patient. Now, this brings us to the golden rule of meningitis. Never delay antibiotics for a CT scan or a lumbar puncture if the patient is unstable or has bad rash. And if you cannot get a vein, don't wait for an ultrasound. Go intramuscular immediately. Meningococcal septicaemia can kill in hours. Every minute will count over here. So, why were the other options wrong? Why not A, CT head? A CT takes 30 to 60 minutes. The patient is septic now. Treat first, scan later. Why not D? Lumbar puncture. This is a lethal error. Our patient is drowsy. If you perform an LP with raised ICP, you will risk brain herniation. Now, why not intubate? While the airway is important, the cause of his decline is sepsis. Antibiotics are the priority while the airway team sets up. So, when do you scan before an LP? Memorize the safety checklist. You must get a CT head first if you see signs of raised ICP. What are the signs of raised ICP? Focal neurology, papilledema, new onset seizures, or altered consciousness. If you see the signs, first is antibiotics, then go for a CT scan, and then go for LP only if CT confirms safety. And if you don't see any signs of raised ICP, you can go ahead with lumbar puncture or LP. Now, if you do the LP, here is how to read the results. It's a simple code. Bacteria will always aid sugar. So, in bacterial meningitis, the glucose will always be low, protein be high, and you see neutrophils. While in viral meningitis, the glucose is normal, you will see lymphocytes and the protein will be normal. Finally, how do we treat it? Don't just memorize doses, memorize the whole coverage. For a standard adult, IV ceftriaxone, which covers Neisseria plus Streptococcus. Also, give vancomycin for resistant Streptococcus, as well as dexamethasone to protect the hearing. The add-on rule. If the patient is over 50 or immunocompromised, you must add IV ampicillin that covers Listeria with IV ceftriaxone and dexamethasone. For neonates, we avoid ceftriaxone. We use ampicillin and gentamicin. Meningitis is all about safety. Treat the rash, respect the ICP, and check the glucose. Thank you for watching. If you found this helpful, hit like and subscribe for more high yield exam content. I'll see you in the next video.